Hello, and welcome to a special edition of SIF's Filmmaker Conversations presented by PNC. I'm Mallory Martin, SIF's Artistic Director. This special Q&A for the documentary Medicine Man, The Stan Brock Story, is also presented in association with the Center for Health and Democracy. Today, we will be joined by the following guests for a discussion about the legacy of Stan Brock and the current state of healthcare provision in the United States. I'm pleased to introduce Wendell Potter, best-selling author, journalist, and president of the nonprofit Center for Health and Democracy. Next up, we have Jeff Eastman, CEO of Remote Area Medical. We have Joe Sandberg, progressive entrepreneur and board member of the Center for Health and Democracy. Paul Michael Angel, filmmaker and director of Medicine Man, The Stan Brock Story. And our special guest, Nina Turner, former Ohio State Senator and congressional candidate for Ohio District 11. Thank you so much to all of you for being here today. We will also be featuring several remote area medical patients and volunteers during the course of the event. Now, it's my pleasure to hand you over to Wendell, who will commence proceedings.
Thank you so much, Mallory, and thank you all for joining us. I'm going to start by just acknowledging that I am one of millions of people here in the United States and around the world whose lives have been touched by the work of Stan Brock. And I'm so grateful that Paul and Vladimir and others have made this amazing film about the life of Stan Brock. I frankly had never heard of Stan when I went back home to visit family in Tennessee some years ago. And I grew up pretty close to where RAM is headquartered in Knoxville, Tennessee. I went to visit family, and I, at the time, was working as an executive at a big insurance company here in Philadelphia. I was working for Cigna, leading corporate communications. And I led a life that allowed me to keep my distance from people who needed health care, even though I was in the health insurance business. I picked up the newspaper while I was there and read something about something called an expedition being sponsored by Remote Area Medical, which I'd never heard of at the time. They were holding this outdoor clinic at a fairground near where I grew up. I grew up in Kingsport, Tennessee. This was in Wise County, just across the state line. I was intrigued because the paper said that people were going to be driving from hundreds of miles away to Wise County. I knew Wise from growing up there. It's a small town in the middle of the Appalachians. I went there out of curiosity. And what I saw when I got to the fairgrounds was something that truly changed my life. I've often said that the road between Kingsport and Wise was my road to Damascus. When I went through those fairground gates, I saw people who were lined up by the hundreds in the rain, waiting to get care that was being provided by amazing volunteers, doctors, nurses, dentists, and others. But I noticed that at this fairground site, people were lined up in many cases to get care in barns and animal stalls. And it just did something to me. It was almost an electrical jolt that woke me up. And I realized immediately that I had to take some responsibility for what I was seeing. I was among those who was working to try to perpetuate our very dysfunctional and broken healthcare system. I also was leading an effort to try to defeat healthcare reform, which I knew more than likely was going to be on the table and being discussed in Washington after the next president or in the presidential campaign. This was in 2007. I also realized that if I hadn't been lucky to get a good education and wind up in a very good job, I could have been one of those people. I am certain that some of the people who were standing in those lines were people I could have grown up with, people could have been related to. So I made a commitment that day to try to figure out some other way to earn a living. I hadn't met Stan at that time. I'm blessed to have had a chance to have met and got to know and become friends with Stan Brock in later years. I reached out to him after I made that decision and walked away from my corporate job and talked to him and some others. And one of the things that I learned was that many people who go to these clinics, almost all of them have jobs, and many of them have health insurance, but they, for whatever reason, are unable to get the care that they need, and in many cases because of high deductibles or Medicare patients who don't have dental benefits or vision benefits or hearing benefits. So I decided that I had to change the whole trajectory of my life. And I made a 180 and left my job, wound up testifying before Congress a number of times the next couple of years, and have gone on to lead advocacy organizations. The Center for Health and Democracy is a nonprofit organization that tries to make a difference, just like RAM does. I testified before Congress during the debate on what became the Affordable Care Act, and I supported that legislation, and it did a lot of good, but it clearly has fallen short. I've been back to RAM clinics since the ACA was passed, and I know that the need is just as great as ever, if not greater. People are still coming to these expeditions around the country in record numbers. I want to bring on a couple of our guests, Nina Turner, who I've gotten to know over the years and who was in the state legislature in Ohio and is running for Congress now, and Joe Sandberg, who I got to know, who's a very successful businessman and entrepreneur in Los Angeles, who've put themselves up for public service and are working in many different ways to try to improve the lives of others. I'll ask both of them, Nina, maybe starting with you, about what you have seen and experienced and know from the people you talk with about our healthcare system and what we need to do going forward.
Yeah, thank you for that, Wendell. And it's an absolute pleasure to be here with all of you. And thank you for what you do. We need more people on the inside of a commodified healthcare system to look at it in the same way that you did and said that something is immoral, something is rotten, and to get out and do a great work like you are doing right now. And Medicine Man, you know, Stan Brock was an absolute hero, standing in the ready position and exposing a system as countless others like him have done for generations. I mean, certainly in my own district, or in my own state where we have 1 million Ohioans who have lost their employee-sponsored health care. We know that the COVID crisis only exacerbated what was already there. And organizations like the National Nurses United, nurses have been sounding the alarm for such a long time to let us know that the healthcare system that we have in a hegemon nation just does not work. This is absolute. Not only is it immoral, but it's not economically sound either. And there are window, and I know that Joe has talked about this a lot via social media and other avenues, to have to pay deductibles, co-pays, and premiums. Sometimes people will not even go to the doctor. They have the insurance, but they still don't have enough to cover the cost. So they make these decisions. They're playing games with their own health because they don't want to be overburdened by those bills. I've seen that not only in my state, but all across the country. It's the same story over and over and over again. And thinking about Medicine Man and the tribute to Mr. Brock's life is such a beautiful thing. It also made me think of a movie that many of us may remember. I think it came out in 2002, John Q. You all may remember that movie where a little boy, I think he was 9 years old, he was on the baseball and he fell out and his parents are going crazy. Turns out he needed a life-saving transplant. And the parents thought they had health care. The father was working a job only to find out he was underinsured. Oh my God, if people have not seen that movie along with Medicine Man, let's put a finer point on this, to understand how absolutely insane that this system is. That not only is it care denied, is care delayed, and it can cause death. That's pretty much, Wendell, the lesson that I've learned, not only in my state. And I joined with some of my, when I was actively in the Ohio Senate to push for Medicare for all, or a Medicare for all type system, universal health care in the Ohio Senate when I was there. And I continue to be a champion for that to this very day. We must have it. And in a hegemon nation, the way healthcare is right now, it cannot stand. And I thank everybody who continues to fight to change this system.
Thank you so much, Nina. Couldn't agree with you more. And you're absolutely right. People with insurance can't use it. They can't afford to use it. So not only do we have 30 million people who don't have insurance, we have probably another 50 million, if not more, and it grows every day. People who have such high deductibles are not able to get the care that they need, and that is a big, big project that we at the Center for Health and Democracy are going to be taking on and shining a light on and holding politicians accountable. Joe, you and I got to know each other after you wrote an op-ed a few years ago, looking at our healthcare system from the perspective of employers and how the system doesn't work for employers either. And I know that you spent a lot of your time helping folks in California and elsewhere, trying to get the health care that they need, try to alleviate poverty, working with folks who are homeless. Tell us what you see, what you've been seeing over the years, and what has motivated you to stay and to get involved and stay involved in this effort.
Thanks, Wendell. And Senator Turner hit it right on the head, which is our current system is both immoral and it's also economically stupid. It's immoral because we know that healthcare isn't something you need to earn. It's not something that is based on merit. It's something that should be based on being human. And what you said, Wendell, resonated with me, I think, especially on that point when you saw humans being treated in animal stalls, right? A society that doesn't provide healthcare for everyone is a society that's inhumane. And then we touch on the point about the economics of it. Our system is both inhumane and it's economically stupid. The system that puts the burden of administering healthcare and health insurance on the backs of businesses is a system that is stymieing entrepreneurship, that is hurting small and medium-sized businesses while allowing us all to subsidize big giant monopolies. And the lie is that businesses in the private sector are opposed to universal healthcare. The only industry that's opposed to universal healthcare is the health insurance industry. Every other industry in the country would love to see a universal system where we can ask big giant monopolies and billionaires to pay their fair share to fund an economy where everyone has healthcare, and therefore more entrepreneurs can start more businesses without the fear of wondering whether their choice to start a business is going to mean that they're putting at risk whether they can take their family to the doctor. And that's really on whom this whole question falls the hardest. The entrepreneurs who don't ever become entrepreneurs, women and people of color who can't ever start businesses because they can't take the risk that starting a business is going to put at risk whether their family can get health insurance and health care. So if we were to move, when we eventually move, because I think that it's inevitable, when we eventually have a universal healthcare system, what we're going to find is both a society that's more humane and a society that has a much more prosperous and inclusive economy. And one of the contributions that I intend to keep making and why I think this movie is so critical is we have to change the culture. This isn't just a question of changing laws. In fact, I think we won't change the laws until we change the culture. And what we have to do in the culture is pierce these two lies. The first is that our healthcare system is the best in the world because, in fact, it's inhumane. And the second is that our healthcare system is some example of free market economics working great because it's not. And if people understand that our system is immoral and economically stupid, it's then that I think we'll be able to harness the political will to change the laws.
Thank you so much, Joe. Jeff, I'll come to you. I know that you got to know and work closely with Stan during the last years of his life. As I understand it, you were among many people who volunteered and ultimately joined the team, and now you're leading that team and carrying on the work that Stan started so many years ago. Can you tell us from your perspective, and I know that you've just been on an expedition, I understand, in Arizona. Tell us what you are seeing now, and what the need is that you know is out there.
Yeah, I'm actually in Arizona right now in a COVID-19 vaccination clinic out here outside of Phoenix. And I've started volunteering over 12 years ago. And I can remember watching 60 Minutes and seeing Stan calling the numbers. And I just, my youngest one was done with 4-H and swimming and going off to college and said, I want to make a difference. I want to take that time and fill it with something. And I thought, which calling the numbers was just anybody could do it, but I soon learned that was the peak of the pyramid in the organization. And the one thing that was really amazing about Stan is he could motivate anybody to make a difference. You know, he wanted to, when you saw what he was doing, how he gave up everything at the age of 49, you know, he turned his back on every career he'd ever had except for being a pilot, and dedicated 24 hours a day to helping other people. And when you look back, when he got that phone call in 1992, a hospital closed in Sneedville, Tennessee. Sounds a little familiar, doesn't it? Hospital closings. He loaded up a pickup truck, a dental chair, and headed out to treat 62 patients. And from there, the phone calls kept coming. Can you please bring RAM to our community? And they still come. They come from Florida. They come from California. They come from New York, upstate New York, where I'm from. They come from Ohio. They come from the Texas. You know, that's the only thing that's changed is RAM's capacity to treat more people. We can now do 4 clinics at a time. But every single clinic we have, there are individuals that will get there the day before. They'll sit in their cars. They'll wait to come in to get one of those precious spots for treatment. And the hardest thing that we do is that person that's been there, and we have to turn them away and say, you know, we really, you know, we just only have so many volunteers, and we can only treat so many people each one of our expeditions that we go. And it's the volunteers that make it. I have a very small staff. I believe that people inherently want to give back and make a difference to other people's lives. And we couldn't do it without the thousands and thousands of volunteers that show up to make a difference. And I'd really like to thank everybody here, and especially Paul and Wendell, for putting a spotlight on the need that's out there and the difference that Stan has made in the lives of others.
Jeff, thanks so much. And we'll come back to you and talk more in a bit. I think it's worth stressing that when Stan founded Remote Area Medical, he just never imagined that most of the work would be in the United States. It was an organization that he founded to fly doctors to very remote places in South America and other parts of the globe. As Jeff noted, then he started getting calls from communities here in the States. I know from talking to Stan that he would like nothing more than for RAM to be put out of business, or at least in the United States, so that the original mission could continue of helping to take care to other places on the planet and not have to spend so much time here in the supposedly the richest country in the world, where the need unfortunately is so great that you can't do that. You have to spend time having your expeditions in the United States. You know, I know that you've got to leave fairly soon. Did what Jeff say and what the experience, what he's seeing on the ground resonate with you and what you're hearing in your community in Ohio and in the district where you're seeking to represent?
Yeah, absolutely, Wendell. It's a universal story. It's the kind of story we don't want to be universal. We want it to be rare. And some of the numbers that are being thrown out there, I mean, if we look at the numbers of people who have lost their jobs because of COVID, and we add them to the already 80 plus million, almost 90 million people, I mean, we're up to about 100 million people and counting who are underinsured and uninsured. And absolutely, that resonates with my community. Cleveland, for example, which is one of the major cities in my district, and I certainly served it as a state senator as well, and as a Cleveland City Councilwoman. I mean, we're one of the top 3 poorest big cities or large cities in the nation. And so that is further exacerbated. Healthcare is your wealth. I mean, that is the true wealth of any individual, which gives them the opportunity to just kind of link to something that Joe was saying. It is the opportunity to be able to dream the big dream and not have to worry about whether or not you can afford. The question becomes not can you afford. We cannot afford to make sure that people are healthy and that they absolutely have healthcare in a hegemonic nation. We are a hegemon nation, and we need to answer the clarion call, the moral call, and both the economic call to be of service to the people of this nation and provide healthcare. And we all know when Medicare as it exists right now was being debated, it really was supposed to be Medicare for all at that time, but the bad type of politics got in the way. But thank goodness we have an opportunity in this moment because of people like Stan Brock and other sheroes and heroes who have been fighting this good fight to ensure that people have health care. And to talk about exacerbation, if you are Black, if you are brown, if you are indigenous, if you are poor, it's even worse for you. I mean, Black people are dying at higher rates because of COVID. It was that condition existed before COVID, hospitalized more. So when you have other factors added on to the fact that this is inhumane, Joe, immoral, and economically stupid, it is worse. So even if people didn't believe what we believed before COVID, there is no excuse right now to just push through Medicare for all at the federal level. I'm glad to see in California that there are some elected officials who are doing that. It probably will take states to do it, just as our sisters and brothers in Canada. It started in one province before it became national in that country, and that may have to happen in the United States of America. But leave no doubt, we have to have the courage to ask for more, and it is unacceptable in the United States of America for anybody to have to grovel for healthcare, whether they live in the 11th Congressional District in Ohio, whether they live in South Carolina, Illinois, California, you name it, anywhere in the United States of America, this should be unacceptable. And I want to thank all of the freedom fighters who are here with us right now and people who are probably tuning in for all that you do to push this.
Nina, thank you so much. Paul, I've seen you shake your head a lot as people have been talking. And you're over in London, I think. You and your colleague Vladimir, who I've gotten to know and talked to, I know you both are probably sleepless in London because of all the work surrounding this film, which you started, as I understand, back around 2012. And you continued to follow RAM over the years. It ended in 2018, I think. The movie does. Here we are 3 years after that. During the last administration, there were attempts to even undo the Affordable Care Act. But I'm sure you've seen that since the Affordable Care Act was passed, that the need for RAM, unfortunately, continues. What have you seen? What was your experience during the making of this movie?
Well, thanks, Wendell. I mean, one of the benefits of making a film that's effectively a time motion study, because you're filming for so long, is you get to see measurable change. And quite simply, there wasn't any, I don't believe, for those in need on the ground in the United States in the years 2012 to 2018. That's evident from the continuing need and the numbers turning up to clinics, and the people who were saying that they had the same types of problems as they had before. I mean, I'm sure that the ACA did something to alleviate some people's situation, but it simply wasn't comprehensive enough in its final iteration to help the people that come to remote area medical clinics, and that is for sure, because they're still coming, and they'll be coming in July to Columbus in Ohio for another remote area medical clinic. I think, actually, and this is a positive note, I think the one thing that did develop in the mind of the American public was an openness to the idea of Medicare for all. I think that for the early part of when we were filming, kind of like 2012 to 2015, it was considered relatively radical, perhaps. But in the later period of filming, I noticed that people were discussing the notion of a free, at the point of delivery, a free universal healthcare system. That it was being discussed openly and casually in a way that it just wasn't. So perhaps there is an opportunity out there. Perhaps the mood really has changed, and this issue, which is this issue, knows no political stripe. It should not. It's absolutely a humanitarian issue. This could well be the chance to get broad support for some serious change in the United States.
Nina, before you go, just to piggyback on what Paul was saying, that interest in Medicare for All is extending finally, unfortunately, to Congress. There's a large percentage of members of the House that are co-sponsors of the Medicare for All bill. Another bill will be reintroduced soon. What actually is holding us back, in your view, from having the kind of reform that we really need in this country?
Oh, Wendell, is that for me?
Yes, that was for you, Nina.
Oh, thank you. I didn't. Yeah, I mean, I definitely want to give a lot of credit to Congresswoman Pramila Jayapal for being such a champion in the House of Representatives. And it definitely goes without saying that Senator Bernie Sanders and having the courage to run in 2016 really started to shake up what was normal to expect in the United States of America in modern times, because we've been through this generation after generation, but for the 21st century version. And so Wendell is real simple for me. It is the intestinal fortitude to stop answering to owner donors. And as Joe laid out, it is the medical community, not the medical, the insurance. Let me be clear, because you have National Nurses United, you have other doctors and people in the healthcare industry who have been shouting from the rooftops that we absolutely must change the way we mete out healthcare in the United States of America. So we have to have, we being the people we elect to office, have to have some intestinal fortitude to go against their owner donors and do something finally for the people of this great nation. This is about a social contract. And you know what, sisters and brothers, it's our money. So when politicians stand up there and pretend as though it's their money, we have to push back and say, no, it is our money. And we, as an industrialized nation, unfortunately, we're not leading on this as the United States of America. We need to follow some of our sisters and brothers in other industrialized nations and make universal health care the norm, and then take it to the next level. Furthermore, even our elders right now who have Medicare, you try to take their Medicare for All, they will wrestle you down. You're not gonna, not that it's a perfect program as it exists, but it has saved so many lives of our elders. And we need to expand that, because we know right now their dental, their vision, their hearing, none of that stuff is covered right now. So we have to expand it. Not only do we have to expand it in terms of making sure it's universal to everybody in this country, we also have to expand the type of care. So Wendell, intestinal fortitude. And to the citizens of this country, to the American people, if they don't want to have intestinal fortitude, let's elect some people who do. And let's go ahead and make Medicare for All a reality in the United States of America. The courage to ask for more. We on the move on this. And thank God for people like Stan Brock.
Absolutely, thank God. And thank you, Nina, for stepping up and stepping out and putting yourself out for public service, and all the best. I think we can turn now to some folks who have been patients, who've experienced RAM up close, who've been patients, who've been volunteers. If we can, if Linda Cryer is available, we can bring her on screen and talk to her about her experience. Linda, hello.
Hi. Sorry, my last name is pronounced Creer.
Creer, pardon me. I should have been.
It's okay. Yeah. I'm not the town crier, but I will be today.
Please do.
I've been weeping because this is a very personal topic for me. In 2000, I spent a lifetime being an athlete, and I was training, and I ruptured 3 discs in my back. And Wendell, I had Cigna PPO.
Wow.
I went through like all the physical therapy and all of that, and ended up having to have surgery and to carve out 3 of my discs. In the middle of that surgery, I ended up with a microscopic hole in my spinal cord, and I leaked spinal fluid for 16 days. And basically, spinal fluid doesn't replace itself. So I had another surgery 16 days later, and then 9 months later, I was diagnosed with stage 4 cancer. And in the middle of all of that, my husband had 2 major surgeries, and I lost my job. he at the end lost his job. We lost our home, all our toys. I'm an educated woman, and my husband is educated, and sorry, he ultimately lost his life because of what it was to him as a man to not be able to protect his family. And it was awful. I'm never going to financially recuperate my losses. My physical health has improved. I'm walking when I was told I would never walk again. And actually, at the Ram Clinic, I was a patient. I stood in line all night. I was there at 2:30 in the afternoon and waited all night to get readers because the state health insurance only pays for one, and I need two. And I stayed, and I came back, and I came back as a volunteer. And my husband overdosed because of the pressure and the stress and the emasculation that occurred to him as the head of our household. So I'm sorry, I've been weeping the whole time you guys have been talking. Stan Brock is a great visionary, and I'm a little Pollyanna myself. I raised 10 other children besides my 2 for free. And I was just raised that if you have enough, you share. And then I don't know what else to say. I'm a little emotional right now. It brings up a lot. It's been 20 years, almost 21. And my son was 8 years old, and my daughter was just going off to NYU. And it was like my son stopped being parented. So it has affected my whole entire family and our ability to parent. I mean, I wasn't parenting. I was so hopped up on opioids just to keep the pain away, because spinal cord pain is, I'd give natural childbirth every day for the rest of my life before I would experience that again. And we were just lost. We were just left out in the open. We lost everything that we worked for. That house belonged to me when I was 20 years old. My first husband, who passed away from diabetes and improperly insured and wasn't going to the doctor like he should have been because we couldn't afford it. And we owned our own business. That house was my home. I lost my home. I lost where I was going to play with my grandchildren in the yard. It wasn't a huge home. It was very modest. And that shouldn't happen in this country, ever, to anyone, ever. It's sick. It is sick what happens in this country.
Linda, it absolutely is. And I think it's important to note that, as you said, you had insurance. You were insured by the company that I worked for. You were in what I'm sure you thought was a good plan.
Oh, it was a great plan. It really was. It was like driving a Jaguar. It just wasn't enough.
It wasn't
20%
enough.
of 3.5 million is a lot of money.
And you are among many, many, many Americans, millions of Americans who have had insurance, who have insurance, who can't use it, or who have to use it and wind up in bankruptcy, losing their homes, everything they have. And it's also important to note that it doesn't just affect the patient, but people in your family.
The whole unit.
Probably generations to come. It's unconscionable.
Now, the ACA actually helped my veteran son, who we had fought with the VA to get him coverage, and they wouldn't even take his claim. But it also hurt my daughter and her husband. But then eventually helped them when they had a baby who was born with a very rare blood disorder and had to have 2 full blood transfusions before he was 8 hours old, and has had several since. And so it's a start. It really is. It's a start. My son now is in treatment, and for his PTSD and his major depression and stuff. But I spent the last 3 years trying to keep that young man alive.
And that shouldn't be. And other countries in the world, we wouldn't be hearing these kinds of stories. Linda, thank you so much. We also have Blanca Ruiz.
This fight.
Yeah. Is Blanca has you joined yet?
Yeah.
Thank you for joining.
Yeah, I'm right
us.
here.
Oh, hi. And you volunteer, right?
Hi.
At RAM Clinics. Tell us what motivated you to get involved, and how you learned about the work of remote area medical, and the role that you've played as a volunteer, and what you see.
I was invited to Remote Area Medical, to participate in Remote Area Medical by Dr. Larry Tabor, who's here in the panel too. And he was part of an organization called Los Médicos Voladores, and I had participated with them for several years as a translator, as a medical translator. So Larry invited me to go in 2011 to the Oakland Coliseum for the first remote area medical here in the Bay Area. And that was incredible. It was a 4-day clinic, and I took time off from my work to participate on that. And the 4 days I was there, I also took my son, who at the time was 15 years old, and he participated on remote area medical in the Vision trailer, where they were graduating classes. They taught him how to operate one of the machines for doing the lenses, and for 4 days he was in the Vision area, and I was translating in all areas, in dentistry, in medical, in chiropractic, in Vision. We had to wear a little vest that said Spanish translator, and you'll be walking around, and all of a sudden, then people, they just grab you, and people that couldn't speak English, they needed to have directions or have questions and all that. But also, I was translating in the, between the doctor and the patient, because some of them they didn't speak any English, and it was a very, very amazing experience, because I really got to hear their stories. I really got to know, what was happening to them and their situations as they relate that to their doctors. And it was very, very sad to find out that these people had not seen doctors for a year. Some of them had very serious conditions, and they had been without any doctors to help them out. I remember in particular, for example, a woman that I think her gallbladder was about to go, and she had very, very serious pains in her gallbladder, and she had not been able to see a doctor for that. And that's a very serious condition that that can end up in very serious situation, and she couldn't see a doctor. They had no money to pay, you know. And another man who had a tumor, you know, actually a tumor, an undiagnosed tumor. Nobody had seen him, and you cannot believe that is happening here in the United States. And I was moved, touched by what Stan Brock was doing, how he brought about all these people, all from everywhere, and came to work with him, volunteer, give their time. And when I saw that, I knew that I wanted to be part of that effort. And I have no medical training whatsoever, but there was one and only one thing I could do, and that was translate. And I figure I'm going to do my part. I want to be part of this movement. And I pledged to help Stan Brock on everything I could. I did 2011 in Oakland for 4 days, in 2012 in Sacramento for 4 days, and 2014 in Reno. And in all of those times, I took my son, and he went, you know, we spent the time doing, you know, making glasses for people. And it was so nice to see people come out with the, you know, glasses, people that had not had glasses for a long time. I don't know, you know, how they were reading or seeing. They just didn't have any glasses, and it was so nice for them to come out of there with a, you know, brand new pair of glasses. And people that in dentistry, it's so sad to see the people, you know, opening their mouth and see all kind of bad cavities and things that could have been prevented. And you know, it's very tragic that here in the U.S., where health should be the highest priority, is not. And I hope to change. I hope things change, and I hope that this movie shows to the world what Stan Brock was all about, and that other people can follow that spirit of altruism.
I couldn't agree with you more. And you mentioned vision and dental, and I know from talking to Stan that a high percentage of people who come to RAM clinics are there primarily because of dental care. It's not a benefit covered by the Medicare program. Millions of Americans don't have private dental insurance. We have thousands of so-called dental deserts in this country. We have Dr. Larry Tibor with us, who, Larry, tell us what you have seen and what you do as a volunteer.
Well, I started, you know, right out of dental school, and you know, I do a couple of clinics a month somewhere on the globe, and I started working with Stan in 2011, and there's so much need out there right now. This healthcare system is so broken. You know, we can just throw a dart at any spot on the map and find need. So when I get a call from Stan, I actually got a call from Stan about 10:30, 11 o'clock my time. So I don't know what Stan was doing up in Tennessee, but he was looking for solutions to, you know, coming into California without a lot of support. Where are we going to find the doctors and what have you? After talking with him for about an hour, I really, you know, we connected on what we do, but I still wasn't convinced until I went to the clinic it was at the Oakland Coliseum, and there he and I were finishing up the day at midnight, loading orange boxes for for the patients to eat while they were in line. It told me the guy was genuine, and from that point, we all start working together. He on the East Coast primarily, in the Midwest, and me on the West Coast, and down into Mexico. But the last few years, this change in healthcare, we were making some progress for a while. In 2013, 14, we were seeing more restorative work. If we look at our numbers counts, some of them were down because it takes longer to fix a tooth than it is to pull it. But now we're going back down the rabbit hole. And, just 3 weeks ago, I'm pulling teeth in Antioch, California in a parking lot, at a veterans center. We're losing the battle. It's just getting more and more difficult. We're falling behind. We need more volunteers. We're actually getting volunteer burnout now. I don't know, Jeff. I don't know how you're finding it with RAM, but we're certainly finding it. My circle of dentists, I'm putting more and more pressure on them to volunteer with one of the other organizations that we deal with. But it's getting bad out there. It is. Saturday I came back did a clinic in Mecca, which is the northeastern tip of the Salton Sea. Right? You talk about a dental desert. There's no help out there for these folks. And so with flying doctors, we can take small airplanes and get into tight places, and we don't need a caravan to do this. So we can sort of hit the hot spots. But it's like taking a teaspoon of ocean water and trying to drain the ocean with it. We're not cutting it, and there's not much government help, and a lot of, in my opinion, misguided attempts at fixing things. And I'll give you my own personal example. I was diagnosed with terminal prostate cancer about a year and a half ago. And it's just a little innocent little tumor that even today doesn't bring me any symptoms, but it snuck into my bones. And so the common medications aren't working, so they have me on a new one. It's $11,383 a month for that drug, 4 little pills. And, I was kind of surprised, but I buy good health care and good supplemental Medicare. And so they said my portion was $1,780. Now I can handle it. I'm a doc. I have a good living. I wouldn't like to budget for it. And I said to someone, I know, Wendell, I know a little bit about the insurance game, how it's played. So I whined, right? And then I get, well, Dr. Tabor, we have a grant for you. Oh, really? I'm not going to qualify for a grant. I make too much money. Oh, no, it's not income based. I said, is it a whiner's grant? Because I was curious a few moments ago. Now I'm kind of angry because I know my mother would have thanked you, tightened her expenses, and paid the $1,700. Right? Most of my patients, on the other hand, would have thanked them, hung up the phone, and not taken the drug. But because I know a little bit about it, and I whined correctly, they're giving me $1,700 a month, and I have no cost for this.
Wow.
The patients just don't know. There is some aid out there, but I'm thinking, is this, Wendell, the insurance game, is this something that is put together to keep Congress quiet?
Yeah.
Because people want to testify to Congress, we have these grants. People aren't using them. That means they don't need them.
Yeah.
Because
it is a game.
Yeah,
you're exactly right.
The one case that sticks with me more than anything else, and it relates to Blanca, actually. My wife and I were at a wedding. It was 10 o'clock at night. I get a call from Blanca. Her next door neighbor had been vomiting since 8 o'clock in the morning. This is, again, 10 o'clock at night. And she wanted a medication prescribed that may stop that. And I said, well, I can't. Number one, it's not my field, but you can't vomit for that many hours and survive comfortably, survive at all. You've only got one choice. You need to get her to the emergency room. As a society, we didn't have $400 or $500 to have some clinic she could go to locally and get care at, say, 10 o'clock in the morning or noon. But at midnight, they admitted her to the ICU. And Blanca, I don't know if you remember that story, but I don't know how many days she spent in the ICU. And as a society, we paid that bill. So I don't know. We need to desperately make some changes, because I can't keep going, twice a month somewhere and fixing these folks, and pulling teeth in a parking lot just isn't humane.
It's not.
It's just not a humane thing to do. And our vets are feeling it as much as anybody else.
Yeah.
Our veterans really are taking the short end. So,
Doctor, thank you so much. Let's go to the other side of the country. Dr. Joe Smitty, I think, is with us, and I've met Joe, talked with him a few times, seen him at RAM clinics. Joe, talk to us a little bit about how you got involved and what you see.
Thanks to all the participants, and Wendell, it's wonderful to catch up with you again. Thank you for what you're doing for us. 1999, the famous missionary Sister Bernie Kinney called me and said, we're going to have an event at the Wise Airport called Remote Area Medical. And so in 1999, she introduced me to Stan Brock, and as a pulmonologist, she wanted some evaluation of coal miners, and we set up a spirometer out in what was really an unbelievable 6 inches of mud. And from there, every year we expanded what we could do. I went to tractor trailer school and got a CDL so I could drive a x-ray clinic on an 18-wheeler. We put in hydroquinone and acetic acid in the dark room, and we could do a high-quality orthopedic and high-quality chest x-ray. And we've overcome many barriers of what we've been told could not be done. And all of our lives were changed by Stan Brock. He loved me because I would always tell the media that he was the world's authority on free health care, that it had to be of the highest quality, and that people who sat in their car all night needed something in return for their visit, and not just to tell them to go find a doctor somewhere. So Stan was our inspiration and our hero. Many people said to me, when Stan is gone, Remote Area Medical is gone. And I said, oh no. Hundreds of people will pick up the ball, because they'll see that we need to follow in Stan's legacy. They'll feel his inspiration. All of us who ever knew Stan Brock are going to push harder rather than less in the future. All of you all are very correct that our healthcare system is not just broken, it's non-existent. We don't actually have anybody who's leading our healthcare system in America. There's nobody that's pulling it all together. I am a medical doctor, MD. I get to say this, but most doctors are owned by somebody in this country. They're not really free to march in the streets and speak out on behalf of patients. They're advocating for the corporate structure that owns their office space. It's I've been looking in mouths for 50 years. Our dental care is worse every year that passes, and the cost of dental care is so expensive. One of the problems we're struggling with now is dentures. They're very expensive, and we pull teeth, and then folks need to really look good in order to get a good job. I was working in an office of 16 providers, and I gave that up to work full time in charities. And I love to support Remote Area Medical. I went on about 50 missions with Stan. But one of the things that we see is what's left when Remote Area Medical pulls out to go to the next place. And so we've really worked on that. We've built clinics like in Wise, Virginia. We built a whole building, a 5,000 square foot $1 million building with x-ray, ultrasound. That was all because Remote Area Medical planted that seed in the ground. We've done the same thing in several other locations. We've participated in starting 2 medical schools. We're now participating with Jeff Eastman and others in supporting the startup of a dental school at Lincoln Memorial University. From Wise, Virginia, it's a 5-hour drive in any direction to a dental school. And when you look in the mouths of those folks, their teeth are, it's not just teeth, by the way, it's oral health and lack of preventive care. And soon we will have a dental school in Central Appalachia that will meet some of these needs. But Stan was our inspiration. Jeff Eastman's doing a great job of following in his footsteps, and those are big shoes to follow. And I'm inspired every morning. I'm 78 years old. I jump out of bed every morning and start looking for somebody that needs some help. And we've just been very busy doing that. We've got 3 tractor trailers that have dental equipment on it with Appalachian Miles for Smiles. We have an eye trailer. I'm sitting outside of a chest x-ray truck as we speak. And so we're trying to use the lessons we learned from seeing who these folks are. Stan brought them to our attention. America had no idea of the need until Stan had folks line up, and the media would flash those cameras on hundreds of people lined up. At one time in New Orleans, after Katrina, we had 5,000 people lined up seeking health care. And those kinds of pictures stick in the minds of the public, and they stick in the minds of volunteers. So Stan inspired us. Thank you all for what you're doing. And I'm just delighted to participate today. Thank you.
Joe, thank you so very much. And thank you for your service. And I'm sure I'll see you at a RAM clinic again before long.
Wonderful.
We have one more volunteer who I'd like to bring on, Matthew Park, who I trust is with us in Knoxville, Tennessee, RAM's headquarters. And Stan was recently telling me a story about his first meeting with Stan and some of the work that he's done. Matthew's also someone who's offered himself up for public service and helps to try to train other candidates to get involved in public service. Matthew, tell us a bit about your connection to Remote Area Medical and what you've seen, what you see in East Tennessee.
Absolutely. Thanks, Wendell. So I first got involved with RAM, and I didn't meet Stan for a year or two afterwards, but I first got involved because I had just completed EMT school at Roane State, and I forget how it happened, but I ended up volunteering with RAM. At the same time, I had started teaching skydiving in the Knoxville area, and Lieutenant Colonel Dick Stoops invited us to go on a skydive into the salute to service at Downtown Island Airport, which I actually live right by. So if you hear airplanes, that's the sound of Downtown Island. So we jumped in there, and shortly after that was when I got to meet Stan for the first time, and we were planning a few things and seeing how we could raise money with some skydiving stuff for RAM. And I went to sit with him and visit, and I went over to the little elementary school, or I don't know that it was an elementary school, but the little old school that RAM was based in then. And Stan greeted me in his pajamas, and we walked around the facility and talked for a while. And shortly thereafter, I got an email from Stan and Dick Stoops saying, "Hey, we think that we're going to be able to go to Andu Falls in Guyana, and we think we're going to skydive into the jungle and build an airport and then get picked up. What do you think?" And that was probably a turning point in my life. Reading that email, I actually looked it up. I still have it before this call. It let me know that the need is so great that we could put ourselves out there in such ways, put ourselves out there in harm's ways, not just to help people, in countries outside the U.S., but that was when I really started seeing that these extraordinary measures that need to take place all around the world need to take place right here in Tennessee. I spent some time working at Children's Hospital, and that's where I really, really saw the need just start to grow exponentially with children. As I've been in and around remote area medical over the past decade, mostly in skydiving these days, but I've seen the need grow, I've seen interest grow, and then in our electoral work, it's really come to light that we have a system that subsidizes pain and rewards failure to keep people healthy, it burns my heart. It hurts my heart so much that we need an organization like RAM. I think Wendell, you said it earlier that Stan would be happy if RAM's mission was complete, right? And I think it's worth just remembering that the reason there is so much pain is because our system not only fails to meet the need, but it also causes the pain. That is one of the biggest things out there. So I've been continually inspired, not just by Stan, but by everyone that I've met over the years that has volunteered and worked at RAM. And in that circle of amazing people that Stan always seemed to pull together. I hope that everyone working together can make this better. But yeah, I've been continually inspired, and that's what keeps me going every day. As we train candidates, we talk to them about the need that's out there. We try to expose them to some of the pain that people are feeling in their own communities, because oftentimes people that are running for office don't know.
Yeah. Well, Matthew, thank you so much. You all have inspired me, and just as Stan inspired all of us to volunteer, to keep Stan's mission alive and going. And regrettably, it's necessary in this country, and it's why, again, that I founded the Center for Health and Democracy. I trust you all may look to see the work that we do. We want to change this, and Dr. Smitty's right. We don't have a system like other developed countries have. We need to hold our politicians accountable, and that's the work that we at the Center for Health and Democracy do. And I wouldn't be here, I know, unless it hadn't been for the work that Stan Brock did. We haven't talked, I don't think, enough about the movie, which chronicles his life and his selflessness. It's just a remarkable movie, and I trust you all will see it. And I might note that the film is up for the Global Health Prize, and that I'd like folks to know that you have until 8 p.m. Eastern Time on Saturday, April the 17th, to watch it and to vote for the movie. So I trust that you will do that. It's a remarkable film, and you will, I know, be as inspired as all of us who've got a chance to know and to work with Stan. Jeff, I might circle back to you before we close out, just with any final thoughts about the work that you all are doing at Remote Area Medical, and how folks can support the work that you all do going forward.
Well, I'd like to thank everybody that's here. This great team is very representative of individuals that want to give back, and motivated by Stan Brock. Stan brought adventure to healthcare. He's made a difference in other people's lives. I'd like to invite everybody who wants to volunteer to go to ramusa.org and click on the volunteer button. If you can't join us out on an expedition personally, you can always support us by going to ramusa.org and click on donate. It's an amazing journey. Everybody, I believe, wants to give back, and join this group that's here today, to giving back and making a huge difference.
Jeff, thank you. Thank you for your tireless effort to carry on Stan's legacy and to meet a need that shouldn't exist in this country. Thank you again, all. Thank you for the Cleveland International Film Festival for helping to put this together today. Paul, I might turn to you just for a final word, because you spent so much time with Stan and made an excellent film, and can see the U.S. from the perspective of someone who lives abroad and in a country that has universal coverage. Any final thoughts from you, Paul?
You know, in the UK, we have a system called the NHS, which is free at the point of delivery and is essentially paid for from taxation. That means that we can't have the best possible treatments, the latest, greatest thing, but we can even out the resources so that everybody has access to something. And that, I think, is the thing that we need to see happening in the United States. It simply isn't fair, the mental toll that it takes on American people thinking, what if something happens to me? What if there's a cataclysmic event, a car crash or something, and my life is completely turned upside down and I can't meet those co-pays? You know, I'm fortunate. I live in a country where we have a safety net that's there to catch us, like should things like that befall us. And frankly, that's an entirely civilized way to organize a society. And if the politicians of America, perhaps, or America broadly, can wake up to that idea, then I think we really can change things in the next years.
I trust so. Thank you so much, Paul. Thank you for your work in making an excellent film. Thank you, Jeff. Thank you all for your tireless efforts to help make sure Americans get the care that they need. And consider volunteering and donating to Remote Area Medical. Check us out at the Center for Health and Democracy, and hold our elected officials accountable. Make sure they do the right thing. And one way is to encourage them to stop taking money from the entrenched special interests that keep this rigged game going. Thank you all very much. And thank you, Stan Brock.